Vitiligo is an acquired skin disease characterized by patches of unpigmented skin. Vitiligo is a skin condition whose exact cause is unknown. In vitiligo, patches of skin lost their pigmentation when the pigment-producing cells, the melanocytes, are attacked and destroyed. It may affect the skin, mucous membranes, eyes, inner ear, or hairs, leaving white patches. The usual type of vitiligo is called vitiligo vulgaris. Variant types include linear, segmental, trichrome, focal, and inflammatory vitiligo. Risk factors. This disease affects an estimated 1% of the world's population. It affects individuals of all ethnic groups and both sexes, but it is much more easily noticed on darker skin as areas that fail to tan. It is hereditary in 1/3 of those affected. Vitiligo is often starts on the hands, feet, or face, and frequently pigment loss is progressive. Half the patients first notice vitiligo before 20 years of age. It often appears in an area of minor injury or sunburn. Also, one's chances of developing vitiligo include having autoimmune disease such as autoimmune thyroid disease. Diagnosis. The diagnosis of vitiligo is usually straightforward and no special testing is needed. While vitiligo is a cutaneous problem and does not affect the health directly, it is disfiguring and may be psychologically traumatic. Causes. Melanin is the pigment that gives the skin its characteristic color. Vitiligo is caused by a loss of pigment in the skin due to destruction of pigments, forming cells known as melanocytes. The exact cause of the destruction of these cells is not known. One possible explanation might be that the body's immune system destroys the cells, as in other autoimmune conditions. Symptoms. Symptoms of vitiligo include an often rapid pigment loss on several areas of the skin. Vitiligo commonly affects areas on the skin that are exposed to sun, body folds such as armpits, previous site of injury, areas around moles, or areas around body openings. It is rare for pigment to return once the white patches have developed. Vitiligo can also affect the eyelids and hair. Treatment. The condition cannot be cured at present, but treatments are available that may be very helpful. 4 options are currently available for the treatment of vitiligo, which are sunscreens, cover-up, restoration of normal skin color, and bleaching of normal skin with topical creams to remove normal skin pigments to make an even color. Conclusion. For many, vitiligo is a major social dysfunction that seriously curtails their ability to lead a normal work, social, or married life. It is no wonder vitiligo patients can turn aggressive, feel a sense of shame, or become withdrawn and resentful. However, vitiligo does not cause physical discomfort to your skin. Also, vitiligo is not contagious in any way. Therefore, it cannot be transmitted through touch nor sharing items. Not all white patches are vitiligo, so when one sees white colored and alley fairs, you should discuss with a dermatologist.